And he just thumbs up, so we're live. Good afternoon. Welcome to Grand Rounds today. Please remember to sign the attendance record at the back of the auditorium, and please also remember to fill out the program evaluation, and if you could give the CME committee any ideas that you might have in regards to future topics or future speakers, we are always appreciative. Today I have the pleasure of introducing Dr. Peter Buck. Dr. Buck is board certified in orthopedics with subspecialty certification in orthopedic sports medicine. He has been kind enough over the years to give us an annual update on sports medicine, and he is here to do so again today. And the title of his talk is the Gadson Sports Medicine Update 2015, and please join me in welcoming Dr. Buck.
Good afternoon. Yes, it's about this time of year I usually give a sports medicine update. Been doing it on and off for a good many years, and it will not, however, have the platitudes of existential consciousness that Dr. Spencer gave you over the last couple weeks. So this will be a lighthearted talk about some pretty straightforward sports medicine topics, but Dr. Spencer gave a couple great grand rounds. Well, typically I give the talk during the big week, the build-up of the big game, Iowa State. A lot of energy, a lot of hyperbole, a lot of posturing, a lot of sandbagging this week as we all make wagers on the game. Of course, the Cyclones are riding on a 3-game winning streak, and who could forget James White's scamper into the end zone a few years ago to secure the Iowa State victory in overtime. Cyclone Stadium is looking good these days. The south end zone's been enclosed. If you got to the game last weekend, it's really pretty impressive. And the place will be rocking this weekend. Everyone walking the sidelines at these games is just amazing. I mean, the fans, the bands, the place is always electric for an Iowa State game. Kinnick Stadium's a great place as well. The fans are particularly loud. I can't wait for the game. Now, I put in this slide for a couple reasons, because usually at this point there is some noteworthy injury of either a Hawkeye or a Cyclone, but there isn't one this week. So I don't have anything really to put in here. I can parenthetically add that I really miss that Hayden Fry has retired, because he used to provide me with so much fodder and so many great lines, high ankle sprains, knowing the difference between pain and injury, and Hayden was a great guy to have around, and I really miss him. Okay, well this is kind of my updated objectives for today. So I'm going to walk you through what I'm going to talk about, and then we'll cover these things. Some of the objectives listed in that the slide ahead of time I won't cover. But so first I'm just going to quickly review the topics that I gave last time. Then I'm going to review some epidemiology of Division I sports injuries. Go through concussion review, which is a hot topic. Sports hernia, biceps tendon, shoulder slap injuries, and get to the title of the talk, the Gadson, and then give some conclusions. So last time, this was my talk. I focused on what do you need to know to set up your fantasy football team. Covered about 13 different sports fracture dislocations all throughout the body. Reviewed Hayden Fry's high ankle sprains, the spectrum, what type of injuries, mechanisms, things like that. Reviewed what it meant to have an injury that you'd likely be out for the season. I covered about 50 different topics last time. That's not my goal today. I'm going to be very limited. But I will make one comment about fantasy football. Over 32 million Americans are now in fantasy football leagues. And here's the interesting factoid, and I actually looked at 4 sites here to make sure I wasn't making this up, that the revenue for fantasy football is over $11 billion and now exceeds that of the entire NFL. And that, to me, is astounding. ESPN says that fantasy football drives 20% of their internet traffic for the whole year. It gives, in the NFL, enhanced attention to every game, and the NFL owners love fantasy football because the interest is really peaked. So if you're setting up your fantasy football team, you need to read pundits that would give you maybe the top 200, but if you notice, they give their top 200 players, but then they talk about injuries, because if you don't know how to evaluate and know what it means for certain injuries, you will not have a winning team. So I'm going to move on to topics maybe I'm a little more familiar with, high school, college sports. Just to review at Iowa State, this is our sports medicine team. We have Dr. Greenwald, Dr. Mark Schulman, who's the official team doctor, family doctor, sports certified, and he's hired by the university and in attendance today. And then Dr. Brian Warmy, who joined our staff 3 years ago. So we interface very closely with the athletic trainers at Iowa State. This is Mark Coberly, the head men's trainer. Shannon Peel in the middle, he's the head football trainer, and Nate Postma as the assistant football trainer. And we really discuss things with them almost on a daily basis during the season. Now, to give you just a little different look of the sports medicine staff, this square-jawed Batman, also known as Dr. Greenwald. This is Green Incredible Hulk, Dr. Warmy, and yours truly at a recent Halloween Mary Greeley get-together, so a different look. And I will, again, shamelessly promote the McFarland Clinic Mary Greeley Halloween get-together that we've had for the last 15 years, but it's been at Hickory's Hall every year, but not this year because Hickory's Hall is closed. So it's Friday, October 30th at the Country Club. These are the OR gals as zombies a few years ago. So it's a good time, and welcome to all. A year back, Dr. Greenwald and I received an honor that was really special to us. We got to appear at the halftime of a high school basketball championship game, and we're honored with our work with athletes at Ames High School and regional high schools, kind of a Lifetime Achievement Award. And it was really, we were truly full of pride because there's nothing like high school athletes. You see them come in, boys and girls at 9th grade, you know, they're pipsqueaks, you don't know which one's going to develop. It's fun to see them develop as people, fun to see them develop athletically, fun to see them mature. And they're really, in the sports medicine field, truly there is no greater joy for Dr. Greenwald, myself, and Dr. Warmy as well, of seeing high school athletes develop. So that was a big deal for us. In college sports, I'm just going to review some epidemiology of injuries in sports, talk about sports produce the most injuries, male and female. So I'm going to refer to the most common sports, or the sports that create the most injuries, but based on exposure. So you might just think, well, it's going to be football, just because of the numbers that are out for football, but the data are injuries per 1,000 hours of exposure. So it kind of equivalents all the sports. So I was going to have a quiz question here as to what sports have the highest number of injuries, and whether or not it be football, basketball, wrestling, football, gymnastics, wrestling, football, soccer, gymnastics, or soccer, track, or wrestling. And this was going to be an official quiz, but who can tell me? Because if you look at your handout, when I made the handout, it wasn't supposed to have this next picture, which gave you the answer. So this was going to be a quiz, but I did check the handout, and the answer was there, so no longer a quiz. But interestingly, it's football, gymnastics, and wrestling. Now, football has, even given the denominator of 1,000 hours of exposure, still has the greatest number of injuries. Interestingly, gymnastics has the greatest number of injuries that need orthopedic surgery, and wrestling is not far behind. And these three, here at Iowa State and across the country, just lead the way with injuries. With ACL ruptures, gymnastics is the most common, with football close behind.